Welcome back. This is part 6 of Hashimoto's thyroiditis. What is it? So we've gone into several videos explaining different aspects of this condition. But to summarize it, in case you're new here, Hashimoto's thyroiditis is a condition that is caused by the immune system attacking your thyroid, making certain antibodies that just causes severe amount of inflammation. And what we find is you have a swelling on your thyroid gland, or you have a nodule or actual goiter that is starting to affect the way you swallow, or we can physically see it just by looking at your neck. And also we can sometimes have symptoms that brought you in that then makes us find these conditions, right? So things like mood swings, brain fog, depression, anxiety, panic attack. We've seen constipation, inability to grow the third part of your eyebrow. We've seen things like severe constipation, if I didn't say that already, right? So different things, right? And heart disease even, palpitations. So when we start to see this in a patient, we're suspecting thyroid condition, but we are also thinking, could this just be hormone imbalance, right? Because certain hormones can also cause some of these symptoms, right? When we don't have enough testosterone, for example, or enough estrogen or progesterone, we can start to see some of these problems. But one main symptom that patient will come in and report that really makes us concerned about this condition is infertility. So we've had several patients that have come in our practice that report that they've been trying to have kids, and every time they will get pregnant, first of all, it will be difficult to get pregnant, and then they've tested themselves, their spouse has tested themselves, and they just keep having spontaneous abortions. So when we hear that, that's definitely a trigger for us to check for this condition by not just checking TSH, which is the most common thing we check for thyroid disease, but by looking at T4, T3, and also the thyroid antibody levels. Okay, so when we check those, we sometimes uncover that, oh my goodness, your antibody levels is in the thousands. Well, that right there is a major problem. So let's say we've diagnosed the Hashimoto's condition. We know the patient has it, but the other hormone imbalances that sometimes might be also going on. So in pregnancy, for example, this is one of the more common risks for patients to actually develop Hashimoto's. Because as you know, during pregnancy, there is a huge surge in different hormones in the body. Besides the HCG, or human chorionic gonadotropin, which is the hormone that we test for to find out if someone is pregnant, that hormone level really gets high, right? But besides that, we also have progesterone, which, as the name suggests, is pro-gestation, right? Meaning it's a hormone of pregnancy. Progesterone level goes from almost nothing, meaning like a level of 1 to 5, to hundreds, right? Within a matter of just days or weeks, right? Once a woman gets pregnant, right? The other hormone that we see a surge in is estrogen. Significant amount of estrogen surge, right? During pregnancy. All of this done because we're trying to maintain that pregnancy. But these changes in hormone levels can actually affect the thyroid function. And as you know, women also experience an autoimmune attack because the body thinks the baby is a foreign thing, right? That is growing in their body. And we can start making antibodies against the baby and against the thyroid gland and against other tissue. So we see very commonly the development of autoimmune disease during pregnancy. So pregnancy itself is a risk factor for autoimmune thyroid disease, okay? Not only does it happen during pregnancy, but again, think about what happens after the woman gives birth, right? The baby comes through the vaginal canal, there's a lot of tears, there's blood flowing this way and that way, as you know. And what happens? Well, the immune system is not very happy with all that activity, and sometimes we do see post-autoimmune disease. And so in patients that have been diagnosed with, for example, postpartum depression, I highly implore you to demand or at least request from your provider to not just say, oh, postpartum depression, here's Zoloft, here's sertraline, here's Paxil, or whatever antidepressant or anti-anxiety medicine that they throw at you, but to make sure that they are actually checking you for these thyroid antibody levels. Because what if that's what's causing your depression? What if that's what's causing your anxiety and your brain fog and your fatigue? And it's not just because you're a new mom or the demand of motherhood and trying to balance a career or all the other things that we blame it on, right? You do have to request this thing. Sometimes the doctor is just going through the routine of, okay, the protocol, the checklist of like, okay, postpartum, okay, depression. All right, here's referrals for psychiatry, or here is a medication to just get you out of that funk. Now, because if it is Hashimoto's, now it's going untreated, which can start giving you other problems, as you know we've talked about. So hormone imbalances can definitely be a cause of Hashimoto's, and especially in women when they get pregnant and immediately after pregnancy and so on. When do we also see hormone imbalances? In patients that have PCOS, right? We do see that. We see hormone imbalances as women get closer to menopause, right? So we call that perimenopause. And that can be for some women from age 35 on. It doesn't have to be the magical 50, okay? It happens as the hormone starts to dwindle. So some women dwindle faster than others, right? Some women have less eggs in their ovaries than others. So each person's hormone imbalance starts to kick in at a different age. So when you start seeing hormone imbalance symptoms, you need to start having your doctors definitely check you for potential, screen you better for thyroid disease. TSH alone is not enough, okay? If anything from this Hashimoto series that you should take home is just testing TSH is not enough. We've got to check the free T4 level. We've got to check the free T3 level. We've got to know whether your body is converting from T4 to T3. We've got to know the health of your gut. We've got to know whether you have the right vitamins in you, whether you're iodine deficient, whether you have iodine excess. All of this matters. We need to know whether you're taking enough vitamin D supplement, whether you're getting out in the sun and making that vitamin D. You know, all of those things are going to play a role in how your body gets better from this disease, and also how it's diagnosed, because that's the first step. If we don't even know you have it, we're definitely not going to be treating it. And then lastly, what approach to treat it? Are you going conventional with just bandaging the symptoms with Synthroid and levothyroxine? Or are you going to do some holistic adjunct where you're going to throw some vitamins in there, heal the lining of your gut, deal and manage your stress, look for some chronic viruses, remove heavy metals from your body? I mean, all of these things has to be done for you to really feel better and go into remission from this disease. And remember, I said remission because you don't actually get cured from autoimmune disease. We put it in remission, which means whenever those factors come back, those triggers come back, voila, antibodies are high again. Because your immune system has memory, it's going to remember this problem and it's going to release more antibodies again. So we got to manage the stress, we got to manage everything chronically to keep this disease in remission. Hope this series has been helpful for you. If you would like more information about this topic, please add it to the section below. I would love to read your comments and answer those questions for you as much as I can. If I don't know the answer, I'll find it for you. All right, I'll see you on the next one.